There is not a controversy. When people know remdesivir में panacea, सब लोगों ने black marketing कर दी और लोगों ने घर में इंजेक्शन लेके कर दिए, as if it will save them. It's absolutely wrong. Remdesivir has never to be used at home. If it is used at home, I don't think we can assess the efficacy or safety of remdesivir at all. It has to be given in the hospital protocol by the doctors who are frontliners under the supervision of the senior consultants. Remdesivir has not to be used in the house. Very, very clear-cut caution. Number two, injectable steroids. Please don't do at house. You don't know what you're doing, how much you're abusing a patient. I know a patient who they gave injectable steroids by putting a drip in the house, and blood sugar was 900. 900. Are you curing COVID or you're killing a patient with the diabetic ketoacidosis? So I think very clearly you have to be very, very careful and let it be a domain of hospitalization. Third, about anticoagulants. I personally believe if one can give anticoagulant like rivaroxaban at home, very safe. I told you the dosage, 10 milligram to 15 milligram, if there is no associated source of bleeding. If there is a piles or fissure or ulcerative colitis or Crohn's disease or bad gums or any area where you bleed more, malignancy, you have to be a little careful and take the opinion of a doctor. Otherwise, in the hospital, it can be used both places. Fourth is Clexane or enoxaparin. Enoxaparin can be easily used at home, but you have to learn the technique of giving it. There is a special technique by which we give an enoxaparin at home. तो वो अगर हम घर में रख लें, वो दे सकते हैं. No question of any tocilizumab or bevacizumab or atezolizumab to be kept at home. This is purely a research molecule, experimental molecules in the research protocols of the hospital. They have to be used by the hospitals only. High flow oxygen has to be used by hospital only. Concentrator you can keep at home. Oxygen cylinder you can keep at home. Again, under supervision of a doctor. And my appeal to everybody at this platform that we all should use concentrator because everything we can't procure from the government. And I will appeal to every member of public, whether it's a society or a welfare association or a Rotary Club or a Innerville Club or a PhD Chamber of Commerce or CII or SHM or FICTI or Gurdwaras or any spiritual organization like temples or any other non-governmental organization. Please take up this as a project. Even corporates to collect concentrators and provide oxygen so that we reduce the burden in the hospital. Then we will not have a problem and no beds available. Some people are admitted because of fear. We don't need it. There are definite criteria, as I mentioned to you. If those people who meet with the criteria, we have in our hospital, Moolchand Hospital, we have created a special protocol, a pro forma, which has to be filled by the patient before coming to the hospital. When we find a patient needs admission, we hospitalize. So this is very important, and I think we cannot keep too much of BiPAPs at home. And the BiPAPs has to be used only by recommendation of a doctor. Similarly, latest gadgets of respiratory support has to be used only by the hospital. Oximetry, everybody should have. Thermometer, we all should have. Mask, we all should have. And we should use all sanitizers. So these are very important. Don't create a store of doxycycline at home. There will be shortage in the market. Don't create a store of azithromycin at home or paracetamol. Take a limitation is freely available. So we should not be in fear to buying more medicines and extra medicines and to make a deficit in the market so others are deprived of the benefit of this medication. I think our aim should be support everyone.